This health insurance CEO was murdered on the street on 6th Avenue in New York a couple of weeks ago. And the reaction to it is not what I expected. 41% of younger people say they support the murderer. And on the one hand, you think, well, clearly there's a spiritual crisis in the country. That's nihilism. There's no defending murdering a guy, any guy, in my opinion. However, it also reveals, so I'm not in any sense justifying it. I think it's appalling. But there's a lot of latent hostility toward the insurance companies. And I want to understand that more. Yeah. I mean, I hate them, but I don't really know why I hate them.
Yeah. No.
You tell me.
What happened is terrible. It's terrible and it's tragic. And I mean, obviously, I never condone violence, and the loss of human life is a tragedy. But so is the loss of 1.7 million Americans a year to chronic disease.
Yes.
And these big insurance conglomerates are implicitly contributing to the chronic disease crisis that America faces. They're profiteering off the disease. They're delaying people's ability to get coverage and care. And there's a lot of money being made through these dark pathways and approaches to these insurance companies and the revenues that they generate. It's all become a profit-driven system. And when I testified in front of the Senate with Bobby Kennedy and the Maha Group, my main message was the corporate capture of our institutions and how that is the real cause of the chronic disease crisis that we're facing. And candidly, the insurance companies aren't only implicitly involved, they are probably one of the major contributors that somehow have gone unnoticed for decades.
Maybe it does make sense. I'm trying to understand it. So the profit motive is designed to improve the quality of goods and services. That's what we've been taught. So in other words, if I pay more for a hotel, if I stay at the Four Seasons instead of Motel 6, I get a nicer room. If I pay more for a car, I get a nicer car. We pay more for healthcare than any country in the world, but we have crappy healthcare.
Yeah.
So what's the difference?
The idea of healthcare insurance started right in Houston, Texas, in the Texas Medical Center with Baylor. Baylor Hospital began to offer insurance plans to patients to try and make it a consistent payment plan where they could have accessibility to preventative care. And that was the premise of what Baylor did.
So health insurance is a fairly new idea?
Well, since the 1930s, but it got captured in the 80s and became HMOs. And so essentially, once it was HMOs, it became a profit center and it changed, it pivoted. And so the money that's being made off of every single chronic disease and by delaying the onset of these procedures and surgeries. So it's pretty nuanced.
It is. And I'm going to ask a ton of dumb questions because I'm uninformed. Yeah. What's the difference between an HMO and like pre-1980s health insurance?
So prior to the 80s, your doctor knew you. They knew your family. They showed up with their little leather bag, knew everybody in the family. They spent time with you. In the system we have today, because the insurance companies control the doctor's reimbursement rates, the clinician only spends 6 minutes with you on average here in the United States. And in 6 minutes, how can they possibly uncover the root cause, talk to you about family history, diet, lifestyle, nutrition, which they're not trained on in the first place. So it created an issue with the ability to prevent chronic disease is one section of that. But the other end of that is once these insurance conglomerates got a hold of our healthcare institutions and took over, they began to profiteer off of the chronic disease. So it's not just where it gets very, very complicated and what people don't understand. Trump actually yesterday announced that he was going to break up PBMs. And when I talked to Bobby Kennedy, I was walking him through the PBM and what it is. So many people say these middlemen, or even when I did Bobby's podcast, he said, what is a PBM? I have insurance, not a pharmacy benefit manager. And I said, you have a pharmacy benefit manager that claims that it outsources your drug coverage to a PBM. But the truth is they own the PBM. It's like Scooby-Doo. So you pull the mask off and it's like, oh, it was Mr. Rogers all along.
So a PBM stands for Pharmacy Benefit Manager.
Pharmacy Benefit Manager. And they were established in the 70s to be an advocate for the American people to drive down the cost of prescription drug care. Their job was to negotiate on our behalf to drive down the cost of our medications.
Yes.
And Along the way, as the insurance companies became a for-profit institution, guess what they did? They went out and they gobbled up all of the middlemen. So the pharmacy benefit managers in America are all owned by the 5 big insurance companies. So when you pull back the layers to the onion, what you find is they've turned the PBM into a profit center. So rather than negotiating down the cost of prescription drug care, they negotiated up the cost. But why? Why would you negotiate up the cost? Because by negotiating up, they get rebates. We would call them kickbacks in any other business. And so essentially, I'll use a real world example. GLP-1s are hot right now. Everyone's talking about the price of Ozempic and how it's so expensive, it's egregious. Roughly 30% of the cost of every prescription drug is because the 30% kickback is going to a PBM. So if Ozempic's $1,000 a month, $300 a month are going to the pharmacy benefit manager via a kickback. It's a pay-to-play system.
So who pays? The drug maker pays the pharmacy?
The drug maker pays the pharmacy benefit manager the $300 per month in order to be placed on a preferred contract with the insurance company, which is the PBM. And it's so staggering. Let's talk about United Healthcare, since that's the CEO that was, unfortunately assassinated. If we break down United Healthcare, they generated $373 billion in revenue last year. Okay. 60% of that revenue came from their pharmacy benefit manager, a holding company that nobody knows about. The general public, our politicians, they don't understand this and they don't get it. And
Are the profit margins high in that business?
The profit margins are not as high as big pharma, but there's a lot of levers that they're pulling to hide their profits, right? And you can make, there's liars, there's damn liars, and then there's statistics.
Yeah.
These guys are using a lot of levers to hide their profitability. And so a lot of the profitability is held at the pharmacy benefit manager holding company. And so they can artificially dilute down their profitability on paper. But as an industry, the health insurance companies, and I said this on Rogan, they are the hidden juggernaut that nobody is seeing. Everyone's saying big pharma, big pharma, big pharma. Big pharma did, I think, $600 million. And you look at these big insurance companies, they did 2.5 that in revenue. 2.5 times that in revenue. They did $1.5 trillion, north of They're projecting that they'll do $1.9 trillion in revenue by 2029.
So can we, in a nod to my personal ignorance, I should just say I don't know. I don't go to the doctor. I don't know what my health insurance plan is. I just have no, once the COVID thing happened, I was like, I'm not going to the doctor.
Yeah.
And I haven't. So I'm a little bit out of it. I'm not as knowledgeable as most Americans on how exactly this works. Can you walk through the average person's experience of health insurance and medical care?
Yeah,
so let's say I'm a 40-year-old woman. Women go to the doctor annually. I think most do. So they use the doctor more. How much is this person paying for insurance? Where's that money coming from? What's the experience like?
Yeah. So the average American, because of our food and our diet and our lifestyle, 90% of chronic disease is driven by lifestyle. If we peel back and look at what's causing these chronic diseases and get to the root cause, it's not just diet, lifestyle, and nutrition. It's that the system is failing Americans. Again, there is no safety net anymore. Your clinician doesn't have the time to do a deep dive. So the cancer that develops in your 40s started in your 30s. The diabetes that develops in your 40s started in your 30s. The chronic disease that hits you in your 50s started in your 40s. If we got proactive and predictive, we could prevent chronic disease. Chronic disease is killing 1.8 to 1.9 million Americans a year, more than every war we've ever fought since the history of this country. That's how staggering this is. Like you and I were talking before we got on this, the equivalent to a 747 jet worth of people are dying every day of opioid abuse. Deaths of despair at an all-time high, greater than that of the Great Depression. Suicide, all-time high. All of these things are through the roof. We are chronically ill as a society. And if we look at the pillars of what's causing that, one branch is the big pharmaceutical industry.
Yes.
Another branch is the food industry, but the other dirty branch is the insurance companies. They are implicitly involved in this, and I'll show you how and why.